So, really, we review some of the emerging strategies for HCC surveillance in patients with viral hepatitis, including those with cirrhosis. And, there are several emerging modalities, both in terms of risk stratification, as well as early detection. So we review some of the clinical risk models in terms of viral hepatitis, as well as one of the emerging biomarkers called PL-SEC-AFP, which was recently shown to help risk stratify patients with cirrhosis in terms of being higher risk or lower risk in terms of developing HCC. And then I discussed some of the emerging imaging as well as biomarker strategies for these patients. So I discuss some of the data comparing cross-sectional imaging using CT or MRI versus ultrasound. And then I talk about a couple biomarkers, including GALID as well as methylated DNA markers for the early detection of HCC. However, I think all of these are early in development and unfortunately are not ready for routine clinical practice. And so at this time, the current recommendations are for us to continue using ultrasound and AFP for HCC surveillance in patients with cirrhosis, as well as those subsets of patients with chronic hepatitis B who are higher risk. I think that, this has been an area of immense interest in terms of, blood-based biomarkers for early detection of HCC. I think the protein marker that likely has the best data for early detection of HCC is GALID. So a biomarker panel that includes AFP, AFPL3, and DCP combined with age and gender. And this has been shown to be highly sensitive as well as specific for the detection of HCC in a large multinational case control study. As well as now some early cohort studies. There are some data that will be coming out later this year in terms of large cohort validation of GALID. But I think that at this time, this is really the best evaluated protein biomarker. There has also been immense interest in liquid biopsy techniques for early detection of HCC. And I think one of the areas that's probably the furthest along are methylated DNA panels, and those have been evaluated in large case control studies. So there are 2 methylated DNA panels that have recently undergone case control validation, and both of those have been published in the past few months. And one of those methylated DNA marker panels was shown to be highly sensitive and specific, with a sensitivity of over 80% for early stage HCC detection and a specificity exceeding 85%. And so, those are now undergoing further validation in sort of prospective studies at this time. I think that really, the reason why serum virology is important, I guess, first, it's important obviously to check serologies for detection of chronic hepatitis B and chronic hepatitis C, and so you can identify the at-risk patients. And then, of course, the viral load, we know in chronic hepatitis B correlates with HCC risk. So the higher your viral load, the higher your HCC risk is. And so these have been incorporated into risk models among patients with chronic hepatitis B. And so I think those are the main reasons to to check serum virology levels, is mainly to evaluate risk level, but not necessarily as a screening test among those patients.